Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty you need to change your community from the inside out. Today is a day that, well, you might want to turn down the volume a little bit because I yell a little bit. It's a good one. Start off with the Journal of American Medical Association on Chiropractics on pediatrics. Journal of American Medical Association on Pediatrics talking about long-term side effects of medications during infancy. You're not going to want to miss that one. Go into a nice little rant about why the Journal of Chiropractic Medicine makes me want to vomit in my own lap, and close with the physiology from the journal stress of how a better functioning nervous system, aka like chiropractic care, helps us better adapt to physical, chemical, and emotional stress. Once again, we started this last week, but I realized that the page actually wasn't up and running, so I fixed it this week. I've been doing really well with in our practice with Facebook videos, educational videos, using the content that we talk about each week in the Chiropractic Research Breakdown. And I put together a nice little free PDF for you guys to maximize your impact of any content that you produce on Facebook using some automation and tools. That if you're making the videos anyway, you might as well look at it. One of the things that I believe and one of the missions that I have in my life is to provide immense value. You guys know that I own the company ChiroEdge. That's kind of the company that runs with this. What we do is provide this information via handout and social media. So yes, I do make money from that, and yes, I do donate a lot to the ICPA, as well as and we donated in the past to I forget who else we've donated to, but we have. But with that, my mission has always been to provide a minimum of 10 or more times the value than dollars I've ever made. That's why I like free resources. That's why we have this podcast. So if you guys want to get that free from us, there's no ask, there's no anything like that. I mean, you're on our email list, so you'll get emailed with random things I think about and research. It's chiroedgemedia.com/10x. Please take advantage of that. And here we go. All right, guys, I have been literally giddy to go over this article with you guys. It's not a chiropractic article. It's actually from the Journal of the American Medical Association, the AMA, JAMA, on pediatrics. And it's called Associations Between Use of Acid Suppressive Medications and Antibiotics During Infancy and Allergic Diseases in Early Childhood. The reason I'm so excited about this is because this is what we've been, this is like what we've been saying. This is the eyes opening at the AMA. This is counter to so many doctors and pediatricians that we have in our community, and it's not our research, it's theirs. What the American Medical Association says is that both gastric acid suppressive medications and antibiotics have been implicated as factors that may enhance the development of allergic diseases. Furthermore, acid suppressive medications which reduce protein digestion can affect how ingested antigens are processed in the intestinal tract. So acid suppression has been shown to increase IgE production in a response to orally ingested antigens in animal studies and has been associated with food and medication allergy in humans. So what they did was they went and they took people who were in the medical services who were on TRICARE, and they went back and looked at TRICARE records for the infants who had been prescribed acid suppressive medications and antibiotics in the first 6 months of life. And what they did was they related it to to development of allergies later in life. So specifically, the medications they looked at were histamine 2 receptor antagonists, which are for reflux, proton pump inhibitors, which are acid suppressors, and antibiotics. So they looked at, here's the study number. This is why I love it, because it's not a chiropractic study. They looked at 792,130 children, and they looked at their birth records, and they compared the rates of allergies to children who took antibiotics and acid suppressors during the first 6 months of life, and they looked at the rates of allergies to people who did not take them. And when it comes to acid suppressive medications, what they found was every allergic disease assessed, and I'll name them: cow's milk, peanut, egg, seafood, other food, anaphylaxis, asthma, atopic dermatitis, allergic rhinitis, allergic conjunctivitis, urticaria, other allergies, contact dermatitis, and medication allergies. Every single one of those, every allergic disease assessed, exhibited a significantly increased risk in children who had received the H2RAs or PPIs during infancy, except for the seafood allergy. Every single one. More so, risk of food allergy after treatment with these acid suppressive medications exhibited a dose-dependent effect with regards to days of medications prescribed. So the number of days in which somebody took an acid suppressive medication meant the higher their risk of getting allergies later in life. So the more days that we have somebody taking reflux meds, the more allergies later in life. In the discussion, we found significant associations between the use of acid suppressive medications or antibiotics in infancy and the development of allergic disease in childhood. Use of acid suppressive medications was positively associated with increase for all major categories of allergic disease and most strongly associated with food allergy. Antibiotics were also significantly associated with all major categories of allergic disease. This study adds to the mounting evidence that agents that disrupt the normal intestinal microbiome during infancy may increase the development of allergic disease. In our study, food allergy, atopic dermatitis, urticaria, contact dermatitis, medication allergy, allergic conjunctivitis, and anaphylaxis were increased by 9 to 51% in children who had been prescribed antibiotics during the first 6 months of life. They were associated with an even greater risk of development of allergic diseases triggered by aeroallergens. Asthma was increased by over 100% and allergic rhinitis by 75% in children exposed to antibiotics during infancy. And here's the even bigger thing here. While the reflux meds, the acid suppressive meds, were dose dependent, meaning that the more days that somebody took these medications, the higher risk they had of developing allergies, antibiotics was not dose dependent. It was significantly increased in anybody even if they only had one antibiotic during the entirety of the 6 months. One round of antibiotics in the first 6 months of life significantly increased the rates of asthma by over 100%. Absurd. So when we see these meds being handed out like candy, and we see the pediatricians just handing it out because they don't want to sit down and figure out what's actually going on with the kid. I'm not saying every pediatrician is like this. We have some really amazing ones in our area, but we certainly have some who just throw it down the kid's throat without thinking. Know that they are going against the research published by the American Medical Association. So when you bring this up to mom and dad, hey, we should be taking conservative measures, allowing their body to heal and to function at 100%, using medication as the last resort and not a first option, we should be addressing them for subluxation and correcting it. The reason is just simply because we're following the recommendations of the American Medical Association, who say that, and I quote from the conclusion, this study provides further impetus that antibiotics and acid suppressive medications should be used during infancy only in situations of clear clinical benefit. Amazing. So, guys, keep on it. Keep spreading the message. Keep telling people that their body is designed to heal from the inside out. Keep telling them the medications can be there in emergency as a last resort and not a first option. And make sure that when you look that parent straight in the face and say, I think that we should take a different route, I think we should avoid these reflux meds for the time being, I think that we should know that that option's always going to be there, but let's try other things first. Know that you are supported by the American Medical Association. Thanks. Alright guys, this next article I'm going over with you guys is just so emotional for me, because it's like such highs and lows in reading this research and getting excited and being let down. And I thought maybe the Journal of Chiropractic Medicine, which is just a crap ACA type, like spinal manipulation, joint dysfunction, don't really care about specificity journal, I thought they actually came out with something that was valuable. I'm subscribed to the journal just because I think it's important for me to read what's happening in journals, obviously, to do this stuff. And I thought maybe I'd actually get my money's worth. And I was so incredibly let down. Just to kind of take you guys through emotionally what happens is, this is what a day in the life of doing this looks like. I got an email from the Journal of Chiropractic Medicine about the press release, just basically saying there were 7 articles that have been impressed since my last weekly alert that I received on February 12th of 2018. So here are the 7 articles that were just published by the Journal of Chiropractic Medicine. The Journal of Chiropractic Medicine. Yes, it says medicine in the name, but remember that it says chiropractic. There should be some things about chiropractic in here, I think. But here we go. These are the 7 articles that this journal that we give money to, that because of the way the chiropractic cartel works, our student loan dollars goes to. This is what they come out with. Number 1. Osteomyelitis of the thumb in a 21-year-old chiropractic patient. A case report. Okay. I guess I care. Next. Reliability of electromyographic assessment of biceps brachii and triceps brachii in cricketers. Right? So, reliability of needle EMG, which is of the biceps, which is really valuable for physical therapy. Not for chiropractic. I mean, yes, there's chiropractors who do physical therapy, but it's not chiropractic. Number 3, ultrasound-guided dry needling treatment of myofascial trigger points for piriformis syndrome management, a case series. Again, why this isn't a chiropractic journal, I don't know. Number 4, effect of foot reflexology on capillary blood glucose, tissue temperature, and plantar pressure of individuals with type 2 diabetes. Again, okay. Correlation of upper body balance, muscle strength, and power in cricketers belonging to different age groups. Okay, that might be important for a chiropractor to know. I'm good there. Multimodal therapy combining spinal manipulation, transcutaneous electrical nerve stimulation, and heat for primary dysmenorrhea. Okay. Influence of spinal manipulation on muscle spasticity and manual dexterity in participants with cerebral palsy, a randomized controlled trial. So I got all excited about this last one, which is once again about spinal manipulative therapy on manual dexterity and muscle spasticity in individuals with cerebral palsy, because it's a case study. Because it's a randomized control trial, and I'm all excited about this, thinking, oh my gosh, of all of those 7 articles, 6 make me want to actually, or 5 make me want to actually vomit in my own lap. And maybe the one, I don't care, but I could see why a chiropractor would care. And the last one, maybe there's going to be some redemption. Maybe there is. So they took, and they had a good amount of individuals with CP, and yes, they non-specifically manipulated the spine for not even for joint dysfunction, they just moved a bunch of stuff for the sake of moving stuff, but it's a randomized control trial, so sometimes there's hard things to study with that. And I think maybe, just maybe there's going to be some redemption here. Just maybe. There are 40 participants in the experimental group, which they manipulated they flying seven them without even looking for joint dysfunction, whatever. I can look past that today because I just need some redemption from the Journal of Chiropractic Medicine. And they had 39 who were in a sham group. And then, don't worry, I should have never have underestimated the ability of the Journal of Chiropractic Medicine to let me down. Intervention. Spinal manipulation was performed by an orthopedic medical doctor certified in manipulative therapy with over 10 years of experience after a 1-hour special training on how to perform sham of spinal manipulation. An orthopedic medical doctor in the Journal of Chiropractic Medicine. Not a chiropractor. Not chiropractic. Anyway, they saw some changes with this in muscle spasticity, the neural component. They saw improvements in manual dexterity, and that's awesome. I'm pumped about that. There's other things that they didn't see. They said there was a reduction of wrist muscle spasticity after spinal manipulation. It provides new data on neurophysiological effects of spinal manipulation, and long-term effects of spinal manipulation on spasticity should be studied further. But those things that happened and changes that happened are greatly outweighed for me by how much of a letdown these groups, these factions of our profession continue to be. So when you, once again, I feel like I'm a broken record in every flippin' podcast, I'm saying the same thing. When you hear the principled, quote unquote, of our profession, the principled researchers, interchangeably use spinal manipulation and adjustment, and interchangeably use subluxation and joint dysfunction, and they say it's just because they want to get into more mainstream journals, look at them and demand more. Demand more. Because this is going to keep happening, and it's going to get worse. Chiropractors no longer own, well, the only thing they do own is the adjustment. It's different from spinal manipulation. It's the adjustment is to correct vertebral subluxation, which is misalignment of the spine that involves a neural component, multiple different components. We don't have to go into that. But you guys know subluxation. We've talked about it. There's multiple different components. There's neurology, pathophysiology, etc. And joint dysfunction and spinal manipulation are not that. Yet when the published researchers of our profession publish on something using words that is not what we do, it messes us all, it screws us all over. So demand more, please, because we, our practice members, our community, the doctors who we come in contact with, who we tell that every man, woman, child deserves the right to be checked for vertebral subluxation and adjusted when necessary. This really takes away from that, and I'm gonna leave it at that. I'm gonna leave it at that, because even though we did see some changes with this study, imagine if we had actually corrected subluxation. Imagine how much better change there would have been in these individuals with CP. So, on to the next one. Alright, this last article is awesome, and it's not a chiropractic article. It's from the journal Stress, which is the International Journal on the Biology of Stress, and it's amazing, and every chiropractor should read it. When we talk about that, and you say the words like chiropractic allows individuals to better process physical, chemical, emotional stress. This is the science of that. Now, I don't want to go too much into the cortisol, the really specific mechanisms here that they talk about, so I'm going to just kind of go through and tell you what you should know, what you should apply to your practice. But if you want to know more about that, I highly suggest reading this article because the discussion section is absolutely freaking amazing. And it's called During Stress, Heart Rate Variability Moderates the Impact of Childhood Adversity in Women with Breast Cancer. So this is in our category of articles that I like to call bridge articles. It's measuring HRV and saying the better an HRV score is, this is what happens. And we know that, while it's not about chiropractic specifically, we know via plenty of other articles of research that specific scientific chiropractic care improves HRV. So you can kind of infer and say, well, if chiropractic improves HRV and improvements in HRV mean this, then chiropractic means this. So this is why I like to call it a bridge article. What they did was they had a population of people with breast cancer. The cancer isn't specifically anything other than they just had this population. And they looked at it and they said, we wanted to look at how people with better HRV scores were able to overcome childhood emotional trauma. It could be sexual abuse, to physical abuse, it could be emotional abuse, it could be anything. And they looked at this population of women, they graded the level of abuse, and they looked at their following HRV scores, and then what they did was they measured their stress responses via serum cortisol levels. I'm going to put this as simple as possible. Women in this study who had better HRV scores, therefore a better functioning and adapting nervous system, like what we would expect to see the change happen with specific and scientific chiropractic care, had less of a long-term physiological response to the stress of PTSD, physical, chemical, emotional abuse in childhood. These individuals had less of a physical stress response to trauma in childhood if they had a better functioning nervous system. The implications of this for chiropractic is huge, because we're talking about how from checking someone for subluxation from birth and improving the adaptability, improving their nervous system, which is measured by heart rate variability, means that the adversity, the trauma that they experience in their life, their body is going to be able to adapt and is going to be better overcome that and not have it manifest physically and stay with us for years and years and years and years and years. If you have a child who's going through something, the loss of a parent, the loss of a loved one, if you have a child who's undergone abuse, they need to get checked and adjusted. They need to. It's the entirety of the rest of their life. The rest of their life depends on it. How they adapt to the scenario. So you meet some people, what this is saying is you meet some people in a pin drops and they freak out. Being adjusted and checked for years and years and years makes them better not able to do that. Makes them better able to adapt to and handle stress. It's amazing. This is what we talk about as principled chiropractors. This is what we talk about as pediatric chiropractors. This is what it is about. You gotta read this. Absolutely. The parasympathetic vagal branch of the autonomic nervous system plays an important role in regulating the physiological response to psychosocial stress and in restoring homeostasis after stress exposure. This investigation revealed, the findings revealed that improvements in HRV, the degree of vagal response to stress, moderated the effect of childhood adversity on both cortisol and inflammatory response to stress. The better functioning someone's nervous system, the better they will adapt to stress. This is the physiology of that. I just got really fired up. I don't want to go too much into it, otherwise this will be a 7-hour podcast. If you guys want more about this specifically, please reach out to us, team@chiroedgemedia.com. I could spend more time breaking this down. I could put together like a video module if that's something that you guys would want, but I'm not going to do that without the demand. So if you guys want me to break down information like this for your teams, just shoot us an email, team@chiroedgemedia.com, and I'll put something together. Appreciate you guys. I'm fired up today. Thank you. Congratulations, you have completed another episode of the Chiropractic Research Breakdown. Once again, I am your host, Dr. Anthony Pellegrino from ChiroEdge. To get on our list, to keep up with our podcast, to keep up with us, as well as to get a free PDF on maximize the impact of any videos or content that you put on Facebook, completely free because it's a mission of mine to give to you more value than dollars that I ever make. Go ahead and go on our website, chiroedgemedia.com/10x. If there's any other things that you would like from us, products that you would like in the future, video modules that you'd like, or topics that you'd like us to encounter, please email us at team@chiroedgemedia.com. That's team@chiroedgemedia.com. Go out this week and slay some subluxations.